The heart has some very complex anatomy with all the vasculature going in and out of the heart, as well as the blood flow within the heart. I'm going to break up this lecture into 3 to 4 components to make the lecture shorter so that you don't have so much time just listening to a lecture, and you can then bop out of the lecture and take a look at some of the images and different facets of learning that we have for you, including e-anatomy and netters, so you can familiarize yourself with those pieces, and then you can come back to the lecture and kind of follow up. So what I'm going to do is break up the lecture into the blood flow going into the heart, the blood flow that's draining the brain and the body and going into the heart itself. And then we'll have a section just on the blood flow within the heart and the anatomy within the heart. Thirdly, we'll have a lecture on the blood flow going out of the heart with the anatomy. And then at the end, we'll follow up with the coronary vessels that feed blood flow to the heart itself, and as well as some of the other related anatomy that doesn't necessarily have to do with blood flow. And so we will go over all of this. So I'm going to start with the outline, and you've got some of the anatomy and terminology here on this first page, and a second set that just covers the blood flow from the entrance of the superior and inferior vena cava into the right atrium of the heart, and ending with the aortic arch, the branches off the aortic arch and the descending aorta. So we'll follow it all the way through. This is a drawing from e-anatomy that I find a little confusing at first, but it can be very helpful in understanding the overall picture of the blood flow within the body. And we're going to break this down to make it a little bit more understandable. But just to briefly go over this, you have the blood flow connections at the top and bottom of the body, like in the feet and in the brain. Actually, pretty much everywhere in the body there is a place where you have arteries that feed into capillaries that go into veins, and the venous blood flow coming from the limbs, the lower limbs, and from the greater intestine here come together and go into the liver, and we'll go over this in more detail. They come out of the liver at the top and go into the hepatic veins. The hepatic veins drain the liver, and all of the blood flow from the body has been filtered through the liver and goes into the inferior vena cava here. And then the blood flow from the brain and from the upper limbs are coming through to the superior vena cava here. And so that goes into the heart, through the right atrium, into the right ventricle, out through the pulmonary trunk into the pulmonary arteries. And the pulmonary arteries go both directions, but they're only showing the flow here, up through into the lungs, getting oxygenated here in the lungs, and then coming out into the pulmonary veins, which return the blood flow to the heart. So now this is oxygenated blood, so they show it in pink here until it gets through the heart. But oxygenated blood coming into the heart through the pulmonary veins. Remember, veins take blood to the heart and arteries take blood away from the heart. But there is this one area where the veins actually carry oxygenated blood and the arteries carry deoxygenated blood. So that is the only confusing part. Well, that's not the only confusing part, but that is one of the confusing parts. So there's blood flow coming back into the heart. It goes into the left atrium, into the left ventricle, and out through the aortic arch here. Ascending aorta, aortic arch, descending aorta, into the rest of the body, both up to the brain here and then into the body and into the limbs here. So we'll look into a little bit more detail of how the blood comes from the areas of the body into the heart, starting with the veins in the upper body. So you have drainage here. The vessels in blue are the veins, and the vessels in red are the arteries. So you have the blue veins draining blood from the head, from the arms, the upper body, and then veins here coming up from the legs. What is missing from the schematic view on the left is the liver and all the organs within the abdominal pelvic cavity. But it gives you sort of an overview of the body itself. And so we're going to go into a little bit more detail. So here on the right we have this view from Netter's, 6th edition, page 2, plate 203. And so you have the right subclavian vein here and the left subclavian vein, and notice how the left subclavian vein crosses in front of the great arteries here, right behind. So there's all those great arteries. They are posterior to the left subclavian vein. And the left subclavian vein, the external and internal jugular veins on the left, the right subclavian vein and the external and internal jugular veins on the right. And those two form the right brachiocephalic vein and the left brachiocephalic vein, which then goes into the superior vena cava. So this is the aortic arch here. The left subclavian and then brachiocephalic vein passes anterior to those great vessels that come off the aortic arch. And you are seeing the blood flow drain from the brain and neck area and then the limbs coming through these external and internal jugular veins, the subclavian veins, and then the brachiocephalic veins coming into the superior vena cava. So that is the blood flow from the upper part of the body. The heart would be sitting right here. Note that the external jugular veins, both on the left and on the right, are quite a bit smaller than the internal jugular veins on the left and on the right. So what we normally will identify on the CT images will be the internal jugular vein, although sometimes it is possible to see the external as well. So let's correlate those with some CT images. So here is the most superior image that I have of these three images. And we're taking a look at the view from the patient's feet again. So this is the right, and this is the left, and this is the anterior portion of the patient, and they are lying on the table here. And so you can see the right external jugular vein here. And on this side, you see the left common carotid artery. And in most cases, as you saw from the previous images, the veins will sit slightly anterior and also lateral to the arteries. So you can see the jugular vein here, and they are lateral and just slightly anterior, not quite very much on this side, here a little bit more anterior than the common carotid artery. So there are the vessels here from the neck and from the head, draining the head and the neck, as we noted in the previous example. And then when you're a little bit lower in the chest, so here we are at just a little bit superior to the arch, the aortic arch, and you have the three great vessels here. So you have the brachiocephalic artery, the common carotid artery, and the left subclavian artery. Anterior to that is that left brachiocephalic vein coming across those great vessels as it goes over to the superior vena cava. And then they sit just posterior to the manubrium. So the manubrium sits as a protector for the great vessels, the left brachiocephalic vein coming across from left to right as it goes over towards the heart, sitting anterior to the aortic arch, which contains the vessels coming off of it, the brachiocephalic artery, the left common carotid artery, and the left subclavian artery. And then we have the right brachiocephalic vein here. So as the left brachiocephalic vein comes across, it will join up with the right brachiocephalic vein, and then they will become the superior vena cava. So now here in this image is just a little bit lower than the one on the right, and you see the ascending aorta here, and we've already gone past the arch, and this is a descending aorta here. You've got the esophagus and the trachea, and now the right brachiocephalic vein and the left brachiocephalic vein have joined together to become the SVC. So still working with the patient's right, left, anterior, and the patient lying on the table here is posterior. So I want to do a quick review of how the blood is drained from the abdomen and pelvis. So you've got the splenic vein coming across from the spleen here, and then it joins up with the inferior mesenteric vein, and together those two join up with the superior mesenteric vein, and that becomes the hepatic portal vein. So the hepatic portal vein goes into the liver at the portal triad and is filtered by the liver, and then the hepatic veins drain the liver superiorly and go into the IVC, and we will see that in the next slide. These two images show that same anatomy in a little bit closer up view so that you're able to see the vessels better. So here's the splenic vein, again coming over from the spleen, and the inferior mesenteric artery, and the superior vein, splenic vein, the inferior mesenteric vein, and the superior mesenteric vein coming across to join up and become the hepatic portal vein, and then they go into the liver. It shows that same thing here on this upper image on your left, and then the blood is filtered through the liver, and then the hepatic veins, the right hepatic vein, the intermediate hepatic vein, and the left hepatic vein all drain into the IVC. And then looking at this on a CT image, and this is from e-anatomy. Once again, this is the posterior side of the patient, anterior side of the patient, right and left. And this is the one of the most superior portions of the liver. You might catch the liver in one or more slices superiorly, but not too many. And you can see here that you have the left hepatic vein, the intermediate hepatic vein, and the right hepatic vein, and they are all moving towards the inferior vena cava as we go superiorly in the body. So those will all join up together into the inferior vena cava, and then that will go directly into the right atrium of the heart. So that covers the venous portion of how all the veins drain the body and go into the inferior and superior vena cava. And next we'll look at the blood flow within the heart itself.